Puerto Rico medical revalidation style question, interstitial atypical pneumonia. Question: a 22-year-old college student presents to the clinic with a 2-week history of non-productive cough, low-grade fever, fatigue, and mild dyspnea. Physical examination reveals scattered crackles but no signs of significant respiratory distress. A chest X-ray, CXR, shows bilateral patchy interstitial infiltrates, image B. His symptoms are out of proportion to the relatively mild clinical findings. What is the most likely causative organism? A. Streptococcus pneumonia, B. Klebsiella pneumonia, C. Mycoplasma pneumonia, D. Pneumocystis jirovecii. Correct answer C. Explanation: this patient presents with atypical interstitial pneumonia, which is characterized by gradual onset of symptoms, low-grade fever, dry cough, malaise, patchy bilateral infiltrates on CXR, more indolent course, walking pneumonia. Discrepancy between clinical findings and radiographic severity. Among the common causes of atypical pneumonia, Mycoplasma pneumonia is the most frequent in young adults, particularly in college students, military recruits, and prison populations. Other organisms that cause atypical pneumonia. Chlamydophila pneumonia, also common in young adults. Chlamydophila psittaci associated with bird exposure. Legionella pneumophila associated with contaminated water, hotels, cruise ships. Coxiella burnet causes Q fever seen in farmers and veterinarians. Viruses RSV, CMV, influenza, adenovirus, more common in immunocompromised patients. Why not the other options? A. Streptococcus pneumonia causes typical lobar pneumonia, presenting with productive cough, high fever, and lobar consolidation on CXR. Sudden onset, not a slow indolent course. B. Klebsiella pneumonia causes lobar pneumonia, typically in alcoholics and diabetics, produces current jelly sputum, and often shows cavitary lesions on CXR. D. Pneumocystis jirovecii, seen in HIV/AIDS patients, CD4 200. CXR shows diffuse bilateral ground glass opacities, not patchy infiltrates. Requires bronchoalveolar lavage, BL, and silver stain for diagnosis. Diagnosis of Mycoplasma pneumonia, cold agglutinins, IgM antibodies, can cause autoimmune hemolytic anemia, PCR or serology for confirmation. No cell wall, not visible on gram-minute of Mycoplasma pneumonia. Macrolides, azithromycin, tetracyclines, doxycycline, fluoroquinolones, levofloxacin, moxifloxacin. Alternative: penicillins are ineffective. Mycoplasma lacks a cell wall. Key takeaways: atypical pneumonia, patchy interstitial infiltrates plus mild clinical symptoms. Common in young adults, walking pneumonia. Most commonly caused by Mycoplasma pneumonia. Macrolides or doxycycline are first-line treatments.